it's more important to have a healthy diet before getting any tumor. Healthy diet is very important, and we do know that having a healthy lifestyle and healthy diet reduces risk of all kind of tumors. After someone has been diagnosed with a brain tumor, one should have a balanced diet, and one should refrain from things which might have an interaction with the treatment. For example, if somebody is getting chemotherapy, we advise them not to have undercooked or uncooked food, which could increase the risk of infections. Similarly, there's a whole diet plan which is given with the chemotherapy to patients of brain tumor. If they're not having chemotherapy, even with radiation therapy, general advice is to avoid things like smoking, because smoking reduces oxygen in the bloodstream, and radiotherapy mostly depends on charged oxygen particles to damage tumor cells. So theoretically, having less oxygen is going to make radiotherapy less effective. In some tumor forms, we know that this effect is quite more pronounced than it is in brain tumors, but generally patients are advised that if they can avoid smoking while they're especially on radiotherapy, it's a good thing. As a general principle, if they can completely avoid smoking and chuck the cigarettes, it's better for general health, even if it won't have a big impact on the tumor treatment or the risk of tumor coming back. There were some studies done recently which showed that certain dietary restrictions or certain types of intermittent fasting or fasting along with chemotherapy might be more beneficial for brain tumor patients. But those results are very early. Those studies are very small on a small number of patients with a particular kind of brain tumor. So we cannot give general advice, and NHS, the National Health Service in UK, and other leading world health authorities at present are not making any dietary restrictions or specific dietary recommendations when it comes to brain tumors or patients receiving treatment for brain tumors. In future, if we find more evidence, I think there is a huge potential of impact of diet on general health and cancer, on the risk of cancer and the treatment of cancer. When more studies are done, and Killing Cancer kindly is committed to these studies too, and more results are available, we'll update you on our channel and we'll give you all the valid information. At present, again, once I stress, there shouldn't be any dietary restriction. If you have a brain tumor and you've had surgery and treatment for it and you're losing weight, you should be having a rich diet to regain the weight. If you're putting on a lot of weight, it's just common sense to try not to have kind of food which would make it worse. Many brain tumor patients need steroids off and on to reduce the brain pressure, especially soon after treatment. Steroids increase the blood glucose level, and a lot of patients do complain of putting on weight after having a brain tumor and getting treatment for brain tumor. But once they come off the steroids, they tend to lose that weight and they go back to their normal body form. So don't be too alarmed and too worried if you are gaining weight after a brain tumor. Talk to your doctor, talk to your dietitian and follow their advice. And if you're losing weight, once again, talk to your doctor and dietitian to get high nutrition diet which would help you regain your weight.